My name is Catherine Goodman, and for those of you who I haven't had the chance to talk with yet, as we've talked many times over the past few years, I'm the Director of Communications and Public Relations for the Blue Ridge Health District, and I'm joined here tonight with a number of panelists who will be providing the latest COVID updates for the district and talking about policies and answering questions live as we go. So Dr. Denise Bonds is here with the Blue Ridge Health District, as well as Ryan McKay, who is the Director of Policy, Planning, and COVID Operations for the district. And we're also joined by Dr. Bell and Dr. Williams from UVA Health, who are both have been working on the front lines during all of COVID response, and will be able to share a really important insight on how the hospital systems are handling COVID right now. So next slide, please. Here's our agenda for the evening. I'm just going to put it up here so that folks can see this as we move forward. And as a reminder that we will be saving this work, there will be a recording of the town hall tonight that will be saved for individuals to watch afterwards. We especially recognize that some of our community members are still without power. And so we will have this recorded for individuals to watch at a later date. And I'm going to pass it to Dr. Bonds to get us started with the next slide.
Thank you, Catherine. I just want to spend a minute here reminding everybody about winter storm safety. I know this is really focused on COVID tonight, but we just had a pretty significant weather event. As Catherine said, some of our citizens are still without power. And I think it's important to remember what to do when we have a winter storm like that. So when the storm is going on, people should stay off the roads and avoid the tree limbs. You want to be careful about your time outside when it's very cold, particularly if you have underlying health conditions. I think something that's really important right now is avoiding carbon monoxide poisoning. Many of us lived on a generator for the last week or so, and you want to make sure that your generator is outside, away from any windows or areas that could allow carbon monoxide into your house. And you want to make sure that you have a carbon monoxide detector. Many smoke detectors now have dual duty and will come with a carbon monoxide, so be sure you check your batteries. And then other things, make sure that you pace yourself when you're shoveling or clearing tree limbs, watch for signs of frostbite, and be a good neighbor and check on your neighbors and make sure they're doing well. And the graphic to the right of the screen shows what you should keep in your car for an emergency kit. We had many residents stuck on I-95 for a good 24 hours during the snowstorm. And so I think it's a really timely reminder that we should all keep Go kits in our car. Catherine, I'll turn it back to you.
All right, and Ryan McKay, you are up.
Thank you and good evening. We'll focus a little bit here on where we are with data as it relates to current cases and transmission, and then we'll talk a little bit more about where we are with the vaccination rates. I think you can see on the right side of the screen where things currently stand in terms of our overall case counts. We are currently experiencing the highest transmission of COVID since the pandemic started. It's a pretty drastic increase in what we've seen over the last couple of weeks. And really what we anticipate is that it will continue to increase. We also recognize that these numbers probably are underreporting numbers, meaning that there are testing that is happening at home that goes unreported to the Virginia Department of Health and to the Blue Ridge Health District. There are people who may not have gotten tested over the course of the last week or so, given holidays, inclement weather, and the cancellation of certain events. And those individuals would be otherwise unreported in terms of our overall case counts. And then people who are maybe mildly symptomatic or asymptomatic carriers are obviously not going to be counted in here if they haven't been tested. All that to say is we are really experiencing the worst in terms of transmission that we've experienced so far. And I think the important part here is not just about the case counts. These sort of seem like numbers. The numbers seem a little bit cold, but there is a very human element to all of this in terms of individuals getting sick. There's the risk of long COVID, which has been proven over the course of the last 2 years of the pandemic. And then there are broader societal, economic, and infrastructure related impacts that we're beginning to see, whether that's issues with supply chains, the ability to operate businesses. And as we'll talk about a little bit later, this creates potential for significant impact on hospitals, primary care providers, and certainly with schools as they begin to reopen this week following winter break and experiencing closings due to the winter storms last week. Next slide, please. Just an update on our vaccination numbers. So this is a representation of what we're seeing across the district. There's going to be variability from one locality to the next. There's going to be variability between our more urban areas and our rural areas in terms of who is vaccinated based on age and demographics and who is not. You can see here that among our age groups on the right-hand side, there are two groups that have not gotten vaccinated to a large part. 5 to 11-year-olds just received access to become eligible to get vaccinated over the course of the last couple of months. So it's anticipated that those numbers would be lower. We are still seeing a significant percentage of our 18 to 24-year-olds across the district who remain unvaccinated. Depending on whether it's urban or rural, will change the demographics of this. In our rural areas, it's more of individuals who are white, and in some of our urban populations, it's people of color who are unvaccinated in this particular age group. And then you can see on the left, more females have been vaccinated than males. Vaccinations remain the most important part of fighting COVID, both in terms of preventing spread, but also worst case outcomes, meaning hospitalizations and death. Next slide, please. And now I'll turn it over to Drs. Williams and Bell for an update on how COVID is impacting hospitals across our district.
Great, thanks, Ryan, and thank you for having me tonight. Appreciate the opportunity to speak with everybody this evening. And just, I want to try to help people understand where we face our challenges within not only our health system, but really all the health systems in the health district and across the country even. As the numbers have gone up, as we've shown on the previous slides, the stress and strain on hospital personnel, staff, and also resources has gone up in lockstep. And so as we see the numbers of people who are testing positive translate into increased numbers of patients who are hospitalized, and today at UVA we set another, what I believe is another record. It's on the slide there for those of you who can see it. 89 patients admitted at this moment, and maybe higher at this point because that was this morning's number. The ripple effects work outward from the units in which we take care of these patients, which has become more than just our specialized units that Dr. Bell can speak to from very up close and personal experience himself. The ripple effects work their way back into the operating room, where I spend a lot of my time as a surgeon, where patients are having a difficult time getting cases to start that are elective, and we've had to prioritize patients who have diseases like cancer and heart disease that is unstable, so to make sure that those don't get delayed. But that then delays patients whose diseases are not as emergent or urgent. That then delays patients who have things that need a longer evaluative period, but then lead to an operation or procedure. That then pushes back into the clinics, and that then means availability for patients to go see their primary care doctors or a nurse practitioner in the community also declines. And so what that means then is you end up oftentimes in the emergency department, either at ours or Martha Jefferson's or any one of the other facilities, including urgent care facilities in the region. We don't have the resources for that, folks. Bottom line, we don't have the capacity to have those dominoes fall all the way back to the community level. And so it isn't just the patients who are having COVID infections that are serious enough to merit hospitalization that are impacted. It's really all of us who are feeling the negative impact of lack or decreased access to the care that we need in a timely fashion. I won't say that anyone has not had the care they need, but I will say that it's very, very likely, and that many of you may have experienced this, that it's taken longer than any of us would have liked for you to get that care. So we're really asking people to not come to anybody's emergency department or even urgent care to get a COVID test. There are other resources. The health district has been tremendously helpful and resourceful in having access for testing. But honestly, if you come to our ED right now at UVA Health for a COVID test, and that's the only reason you're there, you will wait and you will wait and you will wait because there are people who are actually sick with any number of things including potentially COVID, that are more serious and need to be assessed for that level of illness that we can't otherwise detect if they're not there. So if you have aches and pains, you think you might have the flu, by all means, please go to a primary care site, ideally your own primary care site, to be evaluated for those things. Those are still very important factors in our community, and we will, I think, talk about that a little bit later on as well. But if you're really just coming for a test to see if you have COVID, and particularly if you're asymptomatic or if you think you were exposed to someone, we're urging you to find other resources like testing centers, like primary care offices that have a bit more bandwidth and don't have the added responsibility of also taking care of people who are then hospitalized in the wake. And I'll stop there and pass it on to Dr. Bell, I believe.
Yeah, scroll back up if you don't mind, so I can have those numbers. So, I work primarily in the ICU at University of Virginia, where I take care of patients with COVID-19. I take care of the most sick patients. So that's the window through which I view the world. And right now we have the highest number, I believe, the highest number of COVID-19 cases that we've ever had in the hospital, 89. Which is certainly higher than I would have ever thought we would have achieved, or not achieved, but gotten to compared to last year. But that's where we are. There is this discussion about if patients are admitted with COVID-19 or are they admitted for COVID-19, trying to make that distinction of, are you sick specifically in the hospital because of COVID, or do you just happen to have COVID and you're admitted for another reason? I think that's an important discussion to have, but the point I want to get across is when a patient does have COVID, we do have to manage them differently regardless of what their underlying problem is. So we have to put them in isolation so that they don't transmit to other people. Sometimes when they need to be discharged, their a rehab facility may not clear them for transfer until they have a negative COVID test. So patients stay in the hospital longer, they demand more resources. That makes it harder overall to take care of these patients, and it puts the strain on the system. So, on the one hand, we got the highest number of patients that we've ever had, and certainly 25 in the ICU is also a lot. And these are very sick patients. Now, the thing about Omicron is that it's also crushing staffing. It's come at a time when staffing already was an issue because, frankly, after wave, there have been a lot of healthcare workers that have just simply said, this is too much. I can't take this, understandably. But also right now, because Omicron has really shown an ability to start to evade that initial part of the immune response, we're getting some infections. And so a lot of people have asked the question, well, if the vaccines are so good, why are people getting infected? Why are there so many people getting sick? And UVA requires vaccination, requires boosting. We're wearing masks. So how come these people are also getting sick? Does that mean the vaccines are not working? And the answer is no. And that's for a couple of reasons. First, the vaccines were specifically designed to prevent serious illness, and they've continued to do that consistently. We were spoiled early on because they were so effective when it comes to preventing infection. But Omicron has proved to be a very challenging variant. It has really shown an ability to try to get over those initial hurdles. But that backstop of preventing you from getting seriously ill is still holding firm. So it's not like your antibodies can run ahead of your body and drop kick the virus before it touches you. There is a chance that you can get infected, but the difference with vaccination is that you do not get critically ill. And so as opposed to last year when we were taking care of patients from the community and our own team members who were getting sick because they were not vaccinated, this year, we're not taking care of any staff members or anyone who's been fully vaccinated and especially boosted. And I have this habit whenever I have a new patient with COVID, I always ask, are they vaccinated or are they unvaccinated? And I'm starting to get, really that look that why are you even asking this question still? Because the patients I'm seeing are for the most part unvaccinated patients. And so the nature of who's coming to the ICU has fundamentally changed, and full vaccination is very protective against that. So, really the way to decrease strain on the hospital system, you make sure that you're vaccinated. If you are fully vaccinated, you make sure that you're boosted if you're eligible. And if you've done all of that, you make sure that you're wearing a mask when you're indoors. And if you're doing all of that, make sure that those around you are doing the same thing too, because we can expect more people will get infected, but if we're vaccinated and boosted, we can keep people out of the hospital. We can keep the strain off of the healthcare system. And then the last point, the monoclonal antibodies and oral treatments, they are out there. They are not in a large supply right now. There needs to be production ramped up. They're very effective. They're very good. As far as the monoclonals, only one, sotrovimab, is the one that's shown to be effective with Omicron. But this is not what you want to rely on in lieu of vaccination. You really want to have your ducks in a row, and vaccination is the absolute best way to do that. So, they're coming, they're going to roll out, but, we have a very effective therapy right now, and I encourage everyone to go ahead and get vaccinated. Thank you.
Great, thank you so much for that. And before we move on to the next slide, where Dr. Bonds will talk about how people can get vaccinated, I want to remind folks who are using the question and answer feature, we will go over questions at the end. And this question and answer is intended for questions only. There's no chat feature when we're in the webinar type of setting. You can always send us an email if you have other questions we're not able to address tonight, but please, you can put your questions in there that we will address at the end, given the time permitted that we have. And Dr. Bonds, you are up.
Okay, let's spend a few minutes talking about where we are with vaccine. So at this point in time, anyone over the age of 5 is now eligible for a COVID-19 vaccine. Boosters are available if you are 12 and over, and it has been at least 5 months since your second dose. That's a change. Previously, it was 6 months, but now for anyone 12 and over, if it's been 5 months after your second dose, you can get your booster. If you're an adult and you got J&J, you should get a booster 2 months after your initial J&J shot, and you can get any type of vaccine for your booster with J&J or with any of the vaccines, actually. We do have a number of places where people can get vaccinated. The Community Vaccination Center at Seminole Square is up and running and will take both scheduled appointments and walk-in, and they will do your first shot if you're now ready to get vaccinated, or they will provide your booster if that's what you need. We do vaccinate at local health departments. So if you live in one of our localities and that's more convenient for you, look on our website to see what day we are there, and we're happy to provide a vaccine. We will start doing evening hours in February. So if you have school-age kids and you want to come after school, that's more convenient for you. That's available starting in February. MOBI, our mobile unit, is available if you have a business or are an organization and want us to come and schedule a vaccine clinic. We're happy to do that. We do a number of community clinics. Those are on our website as well. Of course, pharmacies and primary care provider are providing vaccine in our community, and you should just call and talk to your provider to see if they've got vaccine available. So the pediatric update, as you can see, boosters are now eligible, and they did decrease the time, and they have asked that children who are immunocompromised, and that's a conversation you need to have with your pediatrician about whether your child meets that definition, should get a third dose of vaccine if they're between the ages of 5 and 11. Catherine, if you... So now let's talk about the CDC guidelines for businesses. These just came out last week. These were changed in part because of the large numbers of individuals that are now infected with Omicron. So if you test positive for COVID-19, you should isolate regardless of your vaccination status for 5 days. If your symptoms are improving, or and you're fever-free for at least 24 hours after your 5 days of isolation, you can return to your normal activities as long as you wear a well-fitting mask for the next 5 days. And by well-fitting, we mean it has to cover your nose and mouth, really should be at least a surgical mask, and you really have to wear it all the time you're around other people, including family members in your home. If you're symptomatic, you should continue to isolate at home until your symptoms have mostly resolved. So if that's 7 days or a full 10 days. And of course, if your symptoms are getting worse, you should talk to your physician about what other things and whether you should get further evaluation. If you are exposed to someone who's a positive COVID-19 case, you will, what you do depends on your vaccination status. So if you've been exposed to a coworker or someone else who's positive for COVID and you're fully vaccinated and boosted, you just need to wear a well-fitting mask for the next 10 days. So you can go about your normal activities as long as you have that full vaccine series and you're boosted, and wear that mask for the next 10 days. If you're not fully vaccinated, that is, you have started your series, but you haven't gotten your second shot, or you got 2 shots 6 months ago, but haven't gotten your booster yet, or if you're unvaccinated, you're going to be asked to quarantine for 5 days, then followed by 5 days of strict mask usage when you're out and around anybody in public. So we feel businesses are fine to follow these new guidelines as long as they can be assured that individuals that work in their businesses adhere to those guidelines appropriately. And again, we're really encouraging people to use high quality, secure fitting masks. So those would be a surgical mask or an N95 or a KN95 or KF94. And they need to be worn for days 6 through 10 of the isolation period.
As Dr. Bonds mentioned, there are some significant changes that the CDC made for the general population. And one of the things that we've looked at are, what does this mean for schools and daycares? How does making these changes right now impact their operations? And if we were to recommend these changes right now, would schools be able to stay open so that children can attend for in-person education? And I think what we discovered when we looked at the data, when we were trying to figure out what the processes and procedures would be to implement these changes, we just didn't feel comfortable in a good conscience making these decisions now to recommend 5 days of isolation or 5 days in quarantine for daycares and schools. As I mentioned earlier, we are experiencing the highest transmission rate we've experienced throughout the entire pandemic. The timing of the CDC recommendations came out when all of our schools were in break. And then you add the additional week where I think all of our schools missed time last week, particularly the whole week, where they wouldn't have normally had to plan for a change in operations. Dr. Bonds also mentioned the masking requirement for days 6 through 10. This presents some operational challenges, but most importantly, it creates additional risk. For the most part, children are eating indoors, they're eating in classrooms, they're eating in lunchrooms, and those children who would normally be in isolation and quarantine would be presenting a potential risk to others. Transmission still occurs between days 6 through 10. The CDC even references this in their explanation, that the average peak is actually goes up to 8 days after symptom onset. And so we felt more comfortable at this point in time, given the transmission, how quickly Omicron, how easily Omicron can infect others, to maintain the 10 days of isolation as a recommendation for schools and daycares, and same with quarantine for schools and daycare facilities. Schools may make the decision to change those recommendations or adopt a policy that may be a little less stringent, and we will certainly support them in how we can contact trace and case investigate in those situations. They also may have to make decisions about operations when it comes to teachers and staff. In terms of just keeping the doors open, buses running, they may have to adopt some different procedures when it comes to the 5 days of isolation and 5 days of quarantine, just to keep schools in operation. Some schools may adopt a test to stay policy for their faculty and staff. I know there is a pilot program right now for students, but if we don't have teachers, we don't have bus drivers, we don't have people serving and making lunches for our students, schools are not going to be able to keep the doors open. And while this is the decision we're making in terms of a recommendation right now, we will continually explore where we are with our transmission rates what we're seeing in schools in terms of transmission, and working with our schools and our local pediatricians to talk about the right decision and the right timing for when we would adopt something different, like the 5 days of isolation and the 5 days of quarantine for schools. Again, the goal for us is to keep schools open for in-person education, and all of the things that are happening, both in terms of transmission of COVID in our community, what operationally schools would have to do to ensure the least amount of risk to students at this time. The timing just isn't there. And if you were to ask me if this was applicable when we were in June and July and case rates were really low, I probably would have said we would support it wholeheartedly. But at this point, just given the amount of transmission that's occurring, the amount of burden and strain that that's going to put on our school systems, right now is just not the right time to make that decision as far as isolation and quarantine changes for our students, faculty, and staff. Next slide.
All right, thank you all so far. So I'll provide a brief update on all of our testing resources. And I will just preface with saying we are very aware of the high demand for testing in the community right now. We are trying our best to provide as many testing resources as possible. The Blue Ridge Health District, a VDH contracted lab called Next Molecular, and UVA Health all offer routine community-based drive-through testing. And this is all PCR testing, and it's free and available to the community. We understand that there have been some lines recently, and around the holidays, around the 10 days before and after Christmas, we tested thousands of individuals. So we know that folks want to get tested, and we're trying to meet that demand as best as possible. To help meet part of that demand, there will be a new community testing center that will be opening this Saturday, the 15th, and it is at the Pantop Shopping Center next to Food Lion. It'll be open Saturdays through Thursdays during regular business hours, and it'll be by appointment only. But it is a new site that is run in partnership with the site that manages the community vaccination center at Seminole Square. So this will be a testing center similar to the vaccination center. It'll be helpful for folks to get in and out pretty quickly, but it will be by appointment only. And that's just for us to be able to maintain the demand for testing right now and to reach everybody as best as possible. So we will have that for individuals who are unable to schedule an appointment online. You can call our hotline, and I'll have that information provided at the end of the slide deck. We certainly want to support everybody who's not able to have internet access or is not as computer savvy, and you can call us and we can help you schedule appointments. So a few other updates regarding all of our testing sites in the community. All of our Blue Ridge Health District sites, which we run in each of the localities at the health departments Monday through Thursday, and then on Friday nights at the JCPenney parking lot at Fashion Square Mall. Moving forward, effective tomorrow, all of these test sites will be by appointment only. You can scan the QR code on your screen to actually bring up our testing website that lists out the full schedule of upcoming testing sites, and there's links on there for how you can pre-register. And there's also, for the sites that don't have registration, like UVA Health sites and the Next Molecular sites, those are all walk-in. So all of those details are provided on this website as well. But we are switching to it by appointment only, at least for the health department clinics. The test results are also taking up to 4 days for a few of our sites, and that's because of the really large demand that we're seeing in testing right now. At one point, we were close to 24 to 48 hours, and it's now taking everywhere from 48 to 72 hours, and trying to get our test results as quickly as we can, but while meeting the demand that not only are we seeing locally, but statewide, the state lab is seeing a big demand and increase in testing. Other things to note is that our testing is all weather dependent. So we are working on putting up a large tent in the JCPenney parking lot so that we can actually have cars drive underneath of this tent. This will be a really nice structure, and it will help with allowing all of the testing that's happening outside of JCPenney Tuesday through Friday for them to be permanent sites where we don't have to cancel for any weather concerns. But for example, yesterday we did have to cancel our testing site at Fashion Square Mall on Sunday because it was raining. And when there's a heavy downpour of rain, it really impacts our staff safety due to it getting all of their PPE, their personal protective equipment wet. And it also even gets the tests wet, and as well as the other equipment that we're using to test. So it just compromises the situation, and we're unable to do it for our staff safety. And then only other things is just to remind folks that there are testing options in the community. So our drive-through sites are certainly one of them, but we also have local pharmacies. You can contact your primary care provider, urgent cares, And other providers in the area are able to provide testing. As pediatricians, if you have a child who has COVID type of symptoms, you should certainly contact your pediatrician and see if there's a testing resource that's needed, or a testing that's needed. So we are trying to meet that demand, and we just ask that you continue with patience and be kind to our staff. You know, they are working very hard to test everybody as much as we can, and we're testing hundreds of folks every night. And soon we'll be opening this new site where there will be weekend, Saturday and Sunday clinics as well. And then next slide. So this is just a reminder to everybody that, you know, as you've heard so far, we do have COVID in the community still. We're seeing some great vaccination rates. There's still room to grow, and there are many different layers that can protect us from this. Everything from vaccinations to wearing a mask, distancing, of course, washing our hands, etc. And if you're sick, you should stay home, limit exposure, even type of symptoms like the sniffles and other things that are outside of the norm. That's when you should stay home. And it's just best for us to all be cautious and protect one another. And then we will go to the last slide, which is just a reminder of the resources for where you can get more information. You can call our COVID-19 hotline that is open Monday through Fridays from 8 a.m. to 4:30 p.m. There is, our website is listed here, and then also the email account for the Blue Ridge Health District. So if individuals have questions that we aren't able to address today, you can certainly send us an email and we will follow up with you, but we want to provide as much information as we can. So thank you to our panelists so far. We have a number of questions that have come through. We had a number of community members who submitted questions in advance. So Lasheen, you can close off the slide deck and we will go into a Q&A feature where I will pull up our questions to ask our panelists. And first, we did have a couple questions related to testing. And so I'm going to kind of touch base on the testing piece. And I'd like to ask Ryan first, if you can talk to us. I know you briefly talked before about testing with the schools, but if you can just give us a reminder of any testing options for the schools and this test to stay as well. And I guess any other testing updates. I think they all were kind of similar about what's the weather policy, what's cancellations, how are people notified, et cetera.
Yes, I'll take some of the general questions first. So weather policy is obviously dependent both on temperature, but also what's happening. So heavy downpours are going to be a safety risk to our staff. Last week, Next Molecular and our own health department maybe canceled due to the snow. Snow removal at the mall was slow. And so that would even make it impossible for individuals to get through the parking lot. Notifications, if they're through us, we will notify people based on the email that people use to register for their appointment in Base Plus. We obviously make announcements through media, social media. As far as school testings, there are programs that VDH has provided access to. One is through a VISTA program where schools can do sort of weekly testing of a small number of students to determine if there is someone who is positive with COVID. I think based on the number of students that would be projected to go through that program, and then sort of the transmission rates occurring within schools, it would actually be a low return on that investment, potentially. It does provide some schools with access to the Buy Next Now kits, but again, those kits would be at-home kits. They're not nearly as accurate as the PCR tests are, particularly when students are asymptomatic. So it presents some challenges there. And logistically, it creates some challenges for schools, given the amount of volume you would want to do for that weekly testing pool to truly determine what kind of spread may be occurring. Those opportunities are still there, and I think schools have to look at that and determine whether or not that fits well within their operations, within their own COVID policies. And if logistically they just have the ability to do that, it does put some administrative burden on the schools individually to do that. And we know that in particular, school nurses are already doing a ton in terms of COVID, both in terms of identifying cases, but doing contact tracing when there's a case within schools. And it would be putting some undue burden on our school nurses who are working really hard to prevent spread from occurring within our school systems.
Great, thank you. And a couple other questions have come through regarding how people will get their test results. So I should have mentioned before, when you get tested, the best thing we can recommend right now, because there are such a large number of testing sites in the community, is to make sure that you ask who's testing you and how you'll get those results. So Blue Ridge Health District will give you a handout. We will tell you exactly how you'll get your information and how you can contact us if you don't get your test results, but make sure that you double check that with folks. And then before we jump off of testing, just one more thing, Ryan, if you can share with us the appropriate use of any type of rapid antigen home tests, at-home tests, and what we're seeing with that and how that's affecting our data.
So when people test at home, even and if it's through a proctored test like eMed with the Buy Next Now kits, that will get reported to the Virginia Department of Health. For people who are buying the kits online, they're getting them from their local pharmacy. They do the test themselves. There's no requirement for them to report their positive cases. However, we would appreciate information about that, because then that allows us to do some contact tracing to provide very specific guidance, or maybe even recommend follow-up PCR testing depending on the situation. So those are great ways to sort of figure out at that moment of time what might be occurring. But understand that if you're asymptomatic, those are not very effective tests at picking up COVID. And if you test positive, we want to know that so that we can assist with contact tracing, providing information about not exposing others, and really working to try to minimize risk within the community.
All right, thank you. So now we're going to switch over and talk a little bit about hospitalizations. And so one of the questions that's come through is how many of the hospitalized patients right now are vaccinated versus unvaccinated? And I'm going to go over to Dr. Bell.
Yeah, good question. And I asked our data people right during this meeting just to make sure I had the most up-to-date information. So of our patients who came in with symptomatic COVID-19, 70% of those patients are unvaccinated patients, 30% are fully vaccinated. And that actually fits more or less with the national pattern at around 75% or so of patients who are admitted to the hospital with symptomatic COVID are unvaccinated. Now, to put that in a context, you have to keep in mind that most of the people in our community are vaccinated. We are about 65% or so, unless, correct me if I'm wrong there. So chances are, if you were randomly selecting, you would have a person who was fully vaccinated in the hospital. So the fact that you have a community that's smaller than unvaccinated community is smaller than the vaccinated community, and that smaller unvaccinated community is overrepresented in the hospital, really lets you know that full vaccination really is protective against going to the hospital. Now, the other question, who are these 30% of people that are in the hospital with symptomatic COVID after getting vaccinated? The CDC released a study showing that for most of these patients, they have a lot of chronic conditions. And I'm not talking about things like high blood pressure, or things like that. But these are like immunosuppression, cancer on active treatment, multiple 3 or 4 different organ diseases, kidney failure, that sort of thing. These are the kinds of patients that we're seeing in the hospital who have COVID symptomatic after vaccination. So certainly it's good news that, for the vast majority of people, it's protective from going into the hospital, but it does underscore that for those high risk people in our community, they really depend on all of us to do our job, to do what we can to prevent the spread. And of course, if you know someone who's in that very high risk group, multiple medical conditions, older in age, immunosuppression, make sure that they're vaccinated and boosted as well too, to give them that additional protection.
Great, thanks. And can you just remind us, so when you're saying fully vaccinated, what do we consider fully vaccinated? Is that with boosters or non-boosters?
Yeah, so fully vaccinated right now, according to the CDC, is 2 doses of Pfizer and Moderna or 1 dose of Johnson & Johnson. That I do expect that will change over time, because we've seen that you really want to get that booster dose. So as soon as you're eligible, that is something you're going to want to do. And I expect the definition of what was considered fully vaccinated will change over time. Don't wait for it. Just go ahead and get it.
Great, thank you. All right, and then Dr. Williams, if you could talk with us briefly about what type of treatments are available, or I guess Dr. Bell, if you want to share anything about monoclonal antibodies or ivermectin or any other treatment that has been out that people have discussed for treating COVID?
Sure. So ivermectin is something that gets discussed about a lot, and there were some early, some very early petri dish sort of level data showing that it could prohibit the virus from replicating. The problem is if you use it at the doses that they were using in that petri dish, they would be toxic to human life. You cannot survive at those sorts of doses, and really with many sorts of different medications, if you use them at a high enough dose, they can prevent a virus from replicating, but you also have to stay alive in order to, get the benefit of that treatment. So when we look at the highest quality studies, randomized controlled trials, placebo controlled, so this really the highest level of data that we do to try to answer questions, ivermectin just doesn't pan out. So it's not a treatment that any of us use, and I think any physician who is prescribing ivermectin is not following evidence-based practice at this point. So that's just completely out, and that's not something that we're using. When it comes to patients in the hospital, we've shown that steroids have been very beneficial to patients that are very sick, especially if they're on oxygen. Remdesivir, which is an antiviral medication, very helpful early on. There's also data suggesting it can be used before you go to the hospital if you're high risk. And then people that are severely ill with COVID-19, a lot of times it's not just the virus that's causing the problem, but it's your immune response that's kind of tipped over, that's causing a lot of the problems. So we use what's called immunomodulatory therapies as well. So these specialized sort of therapies that suppress the abnormal immune response. So these are things like tocilizumab, and you don't have to remember these names or anything like that, or baricitinib. So these are kind of like additional sort of brakes to put on the immune system to try to keep people safe. And when it comes to keeping people out of the hospital, monoclonal antibodies are something that I wish we had a lot more of. I think we all do. So sotrovimab, as I mentioned, is the one that does have the benefit to Omicron. The rest don't seem to be that effective for it. And then we have those two pills, molnupiravir, I think I pronounced that at least close enough, and then Paxlovid. Between the two of them, the NIH does have a preference for Paxlovid because it had sort of better numbers as far as efficacy, more tolerable as well. But again, the supply is low right now. So until that really gets ramped up, it's not something that you want to, just, consider that, something that you can fall back on. Vaccination really is the right way to go. So, that's the prophylactic treatment that, we should really make sure that we have.
And Catherine, if I could just jump in and maybe change focus slightly. My challenge to those of us who are listening to this and who are going about our daily lives is, why would you want to have to take a drug that no one can pronounce? If you can avoid this in the first place, right? Avoid having to see if we have the monoclonal antibody on hand, and we have precious little of it. I mean, tiny amounts that we have for a very small number of patients who will be in very, very dire circumstances. Why would you want to go down that route when you can wear a mask and keep yourself socially distanced from individuals, particularly, and I think increasingly Omicron has really proven to us that the cloth masks that many of us, including myself, have worn for months, if not in multiple years at this point, are not as effective. And so if you have access to it, then a surgical mask, which is primarily a paper based mask, is your best bet, is the most readily available. But the masks that end in numbers, KN95, KN94s, N95s are by far our most effective direct protectant for the individual wearing the mask, but also to prevent me from infecting you. If I'm wearing an N95 and I sneeze and cough toward you, my chances of giving you COVID or frankly influenza or RSV or any of them other number of airborne illnesses that we routinely pass back and forth between each other as human beings goes down dramatically. And so when I'm wearing a mask and you're wearing a mask, those odds go down to negligible, frankly. Now, a reminder that a mask covers more than this. The mask covers all of this. And we still, to this day, and I find it remarkable, have a lot of people who still walk around with the mask under their nose, which is really not super duper helpful. I will remind people that we test you for COVID by putting a swab in your nose. And so if we're going to swab your nose, chances are we're going to find COVID there if you have it. if you have your mask down below your nose, you're not getting protection for the people around you, and frankly, not for yourself. So I would continue to really emphasize that we have the means, and other countries have done this far better than we do. And I think one of the reasons that it frankly, it didn't just decimate China was that universal mask wearing was adopted very early on in China and other parts of Asia, very early when we didn't understand the pandemic. And that was based, I think, largely in previous experience in that part of the world with airborne illnesses. COVID is also a SARS, and I won't go into what the acronym stands for, but the first time any of us heard about SARS in the early 2000s was an outbreak in Asia. And pretty much ever since then, people are wearing masks in public. And so I really would encourage people to encourage those around them. I would definitely encourage employers and businesses to really try to be very firm in your insistence that your customers and your clientele are wearing masks, and certainly that your employees are wearing masks when they're in contact with any other individuals, because that will be the fastest way for us to get back to some sense of a regular life, given that we still have a third or more of Americans, and in pockets it's more than that, as we've talked about this evening, who are not either amenable to or yet able to access full vaccination.
All right, thank you. That's really important. And we are working on getting a large order of KN95s or high quality masks available. We're ordering with a great foundation in the area, 30,000 plus, that we're hoping to be able to distribute to the schools and our community members that may not have access otherwise. So we will make sure to let folks know when those become available, as it's important to have that high quality mask. So thank you. And we're going to switch gears a little bit here. We have a few questions about more related to schools and the isolation and quarantine policies, which we'll come up to in just a minute. Before that, talking quickly, if Dr. Bell, if you could give us an answer to a question about the safety and benefits of the vaccine while pregnant and why that's such a high risk group.
Yes, thank you. And I'll try to be quick because I know time is running out. So to be very clear upfront, vaccination is very safe for pregnant women. It's safe for baby as well. The benefit of antibodies that then pass on to baby. So very good idea. And that's why ACOG, any professional society that takes care of pregnant women recommend that pregnant women get vaccinated. What is the risk of being unvaccinated? And that's very important because I think only about a third of pregnant women are vaccinated in the country right now. Pregnant women have a much higher risk of having severe COVID-19. Pregnancy is considered a relative immune compromising condition because if you think about it, you're spending energy to take care of yourself and take care of developing baby. And so the patients that I've seen in the hospital, and I've probably taken care of about 5 to 7 or so pregnant women that were in the ICU. They've all been unvaccinated women. And these are people that are in their 20s who are previously healthy, obviously healthy enough to get pregnant, and, early 20s, multiple chest tubes going to their body. Their lungs look like Swiss cheese. I'm not exaggerating here. That's what we're seeing. And so it's very stressful, obviously, because, what women want to do ultimately when they're pregnant is to take care of baby. But I think the messages have been kind of mixed up early on and continue to go on. So, getting vaccinated right now is the safest thing for you to do.
All right, great. Thank you. So I have seen a few chat questions that are coming through about specific school policies like Albemarle County schools. I will just share that we support the schools on some of their policies, but if you have specific questions about understanding the certain school policies, you should certainly contact your school directly. But with that said, I will ask Ryan if you can provide an update. I know you've talked earlier about the isolation and quarantine policies with the schools. Can you remind us as to why we are offering this and talk about what would be potentially hard if we did adopt the 5-day isolation and how that may impact us?
Yeah, so CDC has indicated that transmission can occur among those who have COVID beyond 5 days. They're very specific about the length of period when that peak infectiousness can occur, so up to 8 days on average. And then there are pretty strict requirements when it comes to days 6 through 10. Wearing a mask consistently, correctly, as Dr. Bonds pointed out, all of the time. And I don't We just don't believe that's going to be possible for schools, particularly when it comes to things like lunch, mask breaks. How do we ensure that students are separated or distanced appropriately when they're not wearing their mask and they're also infectious? It just significantly increases the risk given the type of variant we're experiencing right now, Omicron, that transmits much more easily, and that it creates some significant operational burdens on schools to sort of monitor and maintain those children in days 6 through 10 to make sure that maybe they have a different lunch location, that they're doing something different depending on the class, if it's physical education or band or chorus. And so we're potentially separating children from those experiences and in some ways inadvertently looking at privacy issues when it comes to their health. Those really are the reasons why we've tried to hold off on making this change. Again, the timing of it too is really difficult for schools. It happened, I think, on December 27th. All of our schools were off on break. We had a week where winter weather prevented them from coming back to school, from administrators and teachers, even meeting virtually to determine what this process would look like. And so what we want to do is buy us a little bit of time. Let's see where Omicron takes us. We aren't even at the peak of what we are going to experience. And if we start adhering to the 5 days now, we're potentially putting schools at risk of having to quarantine or isolate entire classrooms, potentially having to close a school or more than one school. And that widespread impact on students, on emotional, social, behavioral, physical, and certainly their learning well-being, I think would be a detriment to what progress schools have made since returning in person full time. They've worked really hard at maintaining operations, and I think at this point we would really jeopardize their ability to do that if we start adhering to the 5 days of isolation and quarantine right now.
All right, thank you. And then another question regarding sports and testing. So I know that
Dr. Williams might have a follow-up to that.
there you go.
If I may briefly, I just want to also emphasize for the audience that Omicron is different in terms of its impact on children, particularly young children. We are seeing many more young kids who are falling ill, not just testing positive, but falling ill with COVID-19 and are hospitalized. And the numbers of children, including infants and newborns, who have become infected and have been critically ill and or died is still a very small number, but it's much higher than it has been to date in the pandemic. And so this is a different variant in terms of impact on kids. And so I applaud the health district's more stringent approach to sort of lowering our guard at this time when we haven't yet peaked, as Ryan said.
All right, thank you. And while we are talking about children, I will ask if Dr. Williams or if Dr. Bell, if you have anything else you want to share specifically about children and their work and their potential exposures and how severe it can be amongst kids. Anything else? Or in ICU, I don't know if Dr. Bell, if you have anything either.
Yes, so we have seen nationally and locally that hospitalization rates for children have gone up. They are at the highest rate that we've seen since the beginning of the pandemic. They're still about a third or more than what we see at the highest risk people, but it's still something to pay attention to. Again, that discussion about hospitalized with COVID versus hospitalized for COVID, that discussion is ongoing, but I think the point that I'd like to make is that enough children are getting sick and very sick to cause concern. And we have to remember that when it comes to children being getting sick with COVID, it's not just, do you go to the hospital or not? There are studies showing that the risk of long COVID is, anywhere between 5 and 10%. So we're talking about, the detriment of having children out of school, they're doing virtual school or out for, 10 days. But thinking about a child who has persistent sort of memory deficit problems, sleep problems, those sorts of issues, cognitive sort of decline that goes on for months. And that's been clearly demonstrated in areas that have had high rates of COVID infection in children. So I think, outside of that, the small chance, luckily small chance that a children will have severe illness, there are other things that we have to be cognizant of. In addition to MIS-C, that inflammatory condition that does happen rarely, but can be very severe. full vaccination cuts that risk down by 91%. So, there are several reasons why we want to make sure that children are vaccinated. And you guys saw my 8-year-old, he's fully vaccinated, proud of it. My 3-year-old Ruby, as soon as she's eligible, she's going to be in that line. So, my hope is that, you see what I do with my children and you do the same for yours. Thank you.
Me too. All of my kids, as soon as possible.
That's great. And I'm sure many of the pediatricians are cheering us on as well that we meet with weekly. So that's great. We appreciate that. Ryan, I'm going to turn back to you and see if you have any other guidance to provide or any input on the schools.
I've seen a number of questions and I've received a number of emails about testing unvaccinated athletes in various schools. Some schools have this policy, some don't. We certainly support that if it's a weekly test, because it does potentially identify individuals who are sick with COVID and would be putting others at risk, not just in the athletic setting, but really in schools as well. For vaccinated students, if they've been exposed, they should get tested 5 days after that exposure to determine whether or not they have COVID and certainly monitor for symptoms. Athletics and other extracurricular activities do create increased risk. There's more close exposure risk given the nature of athletics. There's more time in locker rooms, there's more time in travel. And so adding a layer of protection for student athletes participating in extracurricular activities is really important, because it could have potentially an impact on the broader school community as well.
Great, thank you. And we are nearing just a couple minutes left in tonight's town hall. So to respect everyone's time, I do want to turn over to Dr. Bonds really quick and ask if you have any parting words that you would like to share with everyone, or if any of the doctors have anything else to share. I know there's a lot of concern with Omicron. Our surge is the highest we've seen yet right now. So of course, we're encouraging folks to get vaccinated. We have administrative changes coming our way. We will continue to vaccinate, to continue to test and support efforts that are happening underway to prevent COVID spread, but would love to hear from Dr. Bonds if you have anything else to share.
So I'd like to just start by thanking Drs. Bell and Dr. Williams for being here tonight. I think it's really helpful to get the perspective of the hospitals. This is a really serious state that we're in right now. Our hospitals are very full. We've already seen Centera publicly announce that they're delaying elective procedures at this point in time. And as was discussed earlier, I think everyone in our community needs to do their part to make sure that that resource, that hospital, is there. At any point, one of us could have an accident and need care in our emergency room, in our hospitals. And we want that bed, that operating theater, to be there. You don't know when you're going to need the hospital, and we really need to protect that resource. This is the time to get vaccinated. If you have delayed, now is your time. When we look at the data, we see that communities that have lower rates of vaccination have higher death rates. That's the reality. Communities that have very high vaccination rates have lower death rates. And we see that not just here in the Blue Ridge Health District, but when we look across the state. So I would strongly encourage everyone to get vaccinated. If it's been more than 5 months, please go get your booster. The community vaccination center is open and they will do walk-ins at any point in time. And then again, just a thank you to all the members of our community that have been really helpful in getting themselves vaccinated and their kids vaccinated. I do see lots and lots of community members out wearing masks and wearing them appropriately. And thank you for all the work that you're doing.
All right, thank you all. So we are almost at 8 o'clock. I will just share, we had a lot of questions that came through both during the town hall tonight and also beforehand. And if we did not get to your question, please feel free to email us. Our email is brhealthdistrict@gmail.com. And we are always monitoring our email, trying to follow up with community questions as quickly as we can. So we appreciate all of our wonderful panelists tonight. This will be recorded and we will share this recording afterwards as well. And I think we are set to go. So thank you all. We appreciate you this evening, and it's 8 o'clock. So we're ending right on time. Again, send us an email or give us a call if you have any further questions. Thank you and stay safe.